This is a film about first aid for stock on dairy farms. We shall discuss only those cases where a farmer can be of immediate assistance to his animals. Where possible, it is wise to call in qualified veterinary assistance, but it may often be necessary to give first aid to an animal without delay, so this is really a dairy farmer's version of what to do till the doctor comes. Milk fever usually occurs soon after calving. The cow staggers in its gait, then goes down, very often with its head turned to one side, and finally lies prostrate. The first thing to do is to raise the animal's head so that the contents of the paunch won't flow into the mouth. If this happens, the cow may breathe them into the lungs, causing fatal pneumonia. If possible, prop the cow up on the brisket with a bale of hay or similar stay against the side, or at least pull it around with its head uphill. Milk fever is caused by lack of calcium in the blood through drainage of this mineral into the udder to make milk. The remedy is to get calcium back into the bloodstream as soon as possible, and you do this by injecting calcium borogluconate. It is important to give a full dose of 2.5 ounces of the calcium, and don't hesitate to give double this if the cow is down when you find her. Dissolve the calcium borogluconate in boiling water, and when the solution is cool, pour it into a clean bottle. A rubber tube fitted with hollow needle carries the solution from the bottle. Lift a fold of the cow's skin, preferably behind the shoulder where it is loose, stick the needle in, and allow the fluid to flow through by gravity. To speed up recovery, you may inject in several places. If the fluid starts to run out when you withdraw the needle, put your finger over the hole, then massage the bulge of liquid under the skin to spread it over a wide area. Don't forget, this is merely first aid and is never as rapid and certain as the correct veterinary treatment. Never attempt to drench a cow with milk fever, as it cannot swallow, and never milk fully for at least a day. If no calcium is available, the next best thing is the old remedy of pumping the udder full of air. You can do this with a bike pump and a tire valve from which the rubber has been removed. To avoid mastitis, the teat and bike valve must be well cleaned and disinfected. If air leaks rapidly and the teats have to be tied to retain it, you must untie them within half an hour to restore circulation. Mastitis is inflammation of the udder caused by germs which enter through the teat canal. The obvious symptom is an unusual appearance of the milk. It may have a few white clots. It may change to a watery pink fluid, or it may consist almost wholly of a custard-like pus. The infected quarter is often hot, swollen, and painful to the touch, and the cow may even feel enough pain to make it go slightly lame behind. The treatment is simple. After milking all the healthy cows first, take the sick cow and milk out the infected quarter into a vessel containing disinfectant. Clean the end of the teat with disinfectant, then insert the nozzle of the tube of penicillin, being careful not to let it touch anything else before it enters. Squeeze the entire contents, then drop the empty tube into the disinfectant. Massage the penicillin in the teat upward into the quarter. Repeat this daily for at least 2 more days. Contagious pink eye causes a painful inflammation and may cause temporary blindness. If caught in the early stages, a smear of chloromycetin ointment applied to the inside of the eyelid once or twice during the day will generally clear up the complaint within 24 hours. The ointment may be obtained on a veterinarian's prescription. Barbed wire causes more torn teats than anything else on the farm. Never use it around a cow yard and pick up stray pieces after fencing. Wire gates should always be fully opened and not just allowed to drop on the ground for the cows to be driven over them. Cut-in teats should be treated immediately. If a veterinary surgeon isn't available, then the farmer should attend to the wound himself. Use a mild disinfectant and gently wash the blood and dirt from the cut, then dry the teat. Bring the edges of the cut together with medical adhesive tape or even insulation tape if you have no other. To allow the cut time to heal, leave the tape on for about a week. If in this time the teat is painful, milk should be drawn from the affected quarter by careful use of a teat siphon, which must be boiled before each use. If milk flows from the cut as well as blood, then the milk canal has been penetrated, and to avoid mastitis, a preventive injection of penicillin should be given. All drenching should be carried out with the cow's head in a natural position. The head should not be raised too high. A satisfactory method of opening its mouth is to tickle or press on the palate. Don't pour the drench faster than the cow can swallow, and stop pouring at once if it coughs. It is bad practice and dangerous to hold the cow by the nose or to grab the tongue. This and other methods of drenching increase the likelihood of liquids going the wrong way and so flood the lungs with fatal results. Bloat results from overinflation of the paunch. This is caused by the cow engorging on lush feed, especially legumes. A large bulge appears on the left flank where the paunch is situated. In very bad cases, a cow bulges on both sides, but the real seat of the trouble is always in the left flank. An often effective treatment is the use of a gag made from a piece of smooth stick. Brisk exercising of the animal may give relief. There are many proprietary bloat drenches on the market, any of which may prove effective if bloat is not too severe. If none of these drenches are available, a tablespoon of turpentine or formalin in a pint of water is often worth trying. If none of these treatments is effective, then you can only relieve the cow by tapping the inflated paunch. If it is necessary to control the cow, use a halter or bail it. Tapping can only be done on the left side of the cow, and it is best performed with a trocar and cannula, which you should have convenient for immediate use during the dangerous period. Make the puncture between the last rib and the hip bone, where the bulge is biggest, and drive in the trocar to the hilt. Don't worry about finding any exact spot to make the insertion. A few inches either way won't make any difference, as there are no vital organs in this area for you to damage. Where frothy bloat occurs, a foam collapsing liquid must be introduced into the paunch by drenching or by squirting from a syringe through the cannula or through a long needle into the paunch. Your chemist can supply a suitable drench. Choke is an obstruction in the gullet anywhere between the throat and stomach. It could be due to small potatoes, apples, or small bones. The cow stops feeding, stands with its head outstretched, dribbling saliva and trying to vomit. If the gullet is completely blocked, belching of gas from the paunch is impossible and bloat will result. It is bloat which causes nearly all cases of death from choke. If bloat is serious, the beast should be tapped at once. Leave the cannula in so that the paunch gases can escape while attempts are made to dislodge the object. Where dislodging is too difficult, don't keep trying to remove the obstruction or you'll only harm the cow. The cannula may be left in the paunch for 48 hours or more. During this time, vegetable matter will normally soften and be swallowed. If the bloat isn't too severe and the obstruction can be felt in the neck towards the left side, try to shift it by hand. It may be a bone, which will not soften, but must be removed. Squeeze firmly below the obstruction with your thumbs and try to move the object upward into the mouth. Where the obstruction can't be felt in the neck, it should be searched for by hand. Many cows die as a result of maltreatment, so don't force the object down with a stick or hose, as you may pierce the gullet and kill the cow. Prussic acid poisoning causes rapid death if the animal is not treated quickly. The poison is contained in the growing and regrowth stages of sorghums and saccharides. The sorghum crosses, such as Johnson grass and Sudan grass, can be dangerous before the seed head forms. Cases of poisoning may be expected in late spring and summer. The symptoms are choking and gasping for breath. If the animal is still standing, a drench of 2 ounces of sodium thiosulfate, known as hypo, dissolved in 1 quart of water, should be given immediately. However, it is much more effective to tap the beast and to pour the hypo solution through the cannula so that it acts immediately in the paunch. Lose no time. Without treatment, a cow may die in half an hour after eating the poison. Repeat the dose in half an hour if necessary. The most common wounds in dairy cows are caused by horning. For this reason, dehorning is essential. While waiting for the vet, the first thing to do is to stop serious bleeding. Where loss of blood is excessive, it must be stopped at once by applying pressure with a pad of clean cloth. When bleeding is controlled, the wound should be cleaned by a gentle washing with mild disinfectant and dusted with a powder such as boracic acid until the vet arrives and takes over. The dairy farm first aid kit should be readily accessible and kept properly stocked. A good place to store the kit is in the dairy, as it is clean, cool, and helps to keep the drugs in good condition. The kit should contain purgative drenchers for digestive upsets, injection equipment with spare needle, and calcium borogluconate for milk fever. Penicillin for mastitis, disinfectants, teat siphon, trocar and cannula, curved scissors for clipping hair round wounds. These instruments cost money, and a smear of petroleum jelly will save them from rust and unnecessary replacements. Adhesive tape, and cotton wool. It is essential for a farmer to be ready to administer first aid to his stock in an emergency. But where a qualified veterinary service is available, a wise farmer should always take advantage of specialized knowledge and skill.